Since the eyeballs are our window to the soul, that's how you see blood vessels and nerve tissue without cutting anything. We're often the first doctors to diagnose high blood pressure, diabetes, high cholesterol. We're kind of that front line. Countless patients over the years that I've been the one that alerted them.
There's a little button there for you at the top. Okay. Go ahead and place your forehead all the way in.
I thought, oh, this is gonna be quick, and I'll have a prescription, I'll order the glasses, I'll be good to go.
I can borrow your left wrist.
The staff came and got me and said, we've seated Mr. Garcia, but want to alert you that when we checked his blood pressure, it seemed awfully high.
As soon as I saw that they were gonna measure my blood pressure, I immediately got nervous about it because I knew I had not been doing follow-up visits with my doctor.
Hey Alex, how's it going? Great. Good to see you. It was his first time in our office. And it's kind of hard when you introduce yourself, but in the back of your mind, you're thinking, I've got a life-threatening condition.
I was worried about it.
I got my arm cuff out and my stethoscope and checked his blood pressure, and it was almost double what we would want to see.
The concern was high enough that he called the ER because we had to get this under control. And they were successful in bringing it down. And roughly about 2 weeks later or so, I remember it well, I woke up dizzy and didn't think much about it, but it turns out those were the initial symptoms of a stroke.
If his blood pressure had still been as high as it was in October when I saw him initially, it probably would have been a catastrophic stroke. You look right at the white ball. I feel proud that I've had the education and the training to know how to do it and what to do and when, so I'm glad I could be there for him.
It was possibly a life or death difference.
We're primary eye care providers. We can also be primary care whole body providers. And let me know when it gets too blurry. It could be a very exciting time as the Californians are clamoring for access to health care. We also need the providers to provide that health care.